Hello and welcome to this Rethinking Anatomy video. Today we're going to be talking about the infraspinatus muscle. The infraspinatus muscle forms part of the rotator cuff, and typically when people have rotator cuff injuries or shoulder injuries, they will target this muscle to strengthen it. What we're going to go through today is that's the anatomy of the muscle, what it does in conjunction with gait, but also when we're in the gym, and then areas that we need to consider if we really want to target this muscle from either a strengthening point of view and a movement point of view. So the infraspinatus itself, its anatomy is fairly simple, because on the scapula we have this infraspinatus fossa just meaning cave or cavern, where this lives, and it attaches onto the posterior aspect of the greater tubercle on the humerus. So just where we have this hole here, we can see that this is the attachment site. Now, in most textbooks, it's seen as an external rotator. An external rotation would be this motion or that motion, or basically the arm rotating away from the body. But again, what we're looking at around here is when we have deltoid, when we have pec major and the lats, these are all very big muscles. And just like when we're speaking about the piriformis, we have to appreciate is, does this muscle, with the mechanical advantage it's got, actually have the ability to externally rotate the arm and counteract the movements that are going on in the larger muscles at the front and back? So from an anatomy point of view, we think that why do we need external rotation? And the main reason for this is that when we're getting this counter rotation movement of the body, and when we're going forwards and backwards through the torso, is that if we were purely just stuck into internal rotation and there was nothing to prevent internal rotation moments, the arm would always swing inwards. So we wouldn't have this balance per se of the shoulder weight, the way it sits on top of the rib cage. So the external rotators help counteract this and enable us to keep a neutral, or a theoretically neutral, humerus position against the internal rotators, again, such as a pec major, minor and subscapularis. So we do need an important function of this muscle to keep the shoulder healthy. But when we look at the typical movements that we do, they don't really work in congruency with the anatomical structure of the muscle. So for example, when training the rotator cuff, typically a lot of people will do this motion. So they'll do a motion where the elbow is at 90 degrees and they're bringing the arm backwards like that. Now, the problem with this is that according to basic physics, is that muscles will gain mechanical leverage based on the angle of attachment. And the angle of attachment, when we have the arm up at 90 degrees like this, from the infraspinatus's ability to externally rotate, is virtually at 180 degrees. So in other words, if this is the muscle, the attachment here is acting as a straight line. And due to this, it doesn't really govern itself very well as an external rotator. So what will happen when we're doing this motion is that much larger structures on top will actually be driving the majority of the work. So when people are trying to target this, it's very important to think about what's actually getting the stimulus rather than this muscle. Second to that is that theory that this is an external rotation exercise is highly dependent on a perfect shoulder mechanics. If someone has a reduction in the subacromial space, so basically there is an increase in the change in position of the humeral head, which often happens, it can either reduce and go upwards and sometimes move anteriorly, is that as soon as we get it into this position and rotate, it can create some irritation on the acromion, on the AC joint as well. We also have the supraspinatus muscle on top, which has a tendon that goes through this structure, which again can be irritated. So if somebody has compromised shoulder issues, this could actually require it could create more shoulder irritation than actually overcome a problem. Secondly to that, a very common thing that people will do with the shoulder blade when they're trying to get their arms into abduction is that if there is compromised mechanics around the humerus, we'll get upwards rotation of the scapula. If someone has upwards rotation of the scapula, the upper trapezius fibers, which are typically quite tight or overactive when people have desk posture, are going to be working isometrically just to sustain the shoulder position. Therefore, if somebody's getting heavier and heavier doing their external rotations, essentially they're just training the dysfunctional movement pattern that you're trying to overcome. So what we're going to do now is we're going to go into the gym and look at areas which we need to, where we can change the mechanics of this exercise and more specifically target not just the infraspinatus muscle, but the mechanics and the movement patterns we need to ensure this muscle can actually function properly. So first we're going to be looking at the typical exercise people will use with a cable for training the external rotator or the infraspinatus. So quite common one you'll see is you'll get the client, they'll have their elbow at 90 degrees around that motion, and then they'll be pulling it up, so doing that external rotation position like that. Now obviously this is going to change the difficulty of the exercise based on how far the client is away from the cable, the distance from the cable from the floor, so obviously we can change the difficulty of this. So if you go forward and I drop this down, and then if you go to that position there, if we change the position of the moment arm from the direction of the line of force, so there, it's a little bit of a drop off, but still what you get in here is even if you stabilise the arm and go through there, what do you feel? Just anterior shoulder, so it's not specific enough. Thank you, so I'll take that. Now the problem with that is that that's on the lightest weight. And if we were to say, right, let's increase the weight, the next increment up would be on this stack would be 9.5, so we just doubled it. So really we're not getting that effective stimulus, and all we're doing is getting the client to create a lot of muscle activation around this region, which again is not necessarily what we want or we're trying to specifically target. So instead, rather than actually trying to target this really small muscle, we just need to think about the coupling motions that go with it that are going to help it move and stabilize the muscles around here. So that is going to be thoracic rotation, and it's also going to be the pronation and supination of the arm. So what I'm going to say now is I'm just going to go this, so it's about level. So if Will goes front on there, please, Wood, and then just standing slightly to the side. I just want you to do a rowing motion towards you, and I want the cable to be at a height where it's the continuation of his forearm, so that's the height there. So if I just draw a line across, that's where I want the cable to roughly be. So I'm going to pick it up and just go by 2. I'm going to add a little bit more weight through here. And this is a position where we want to target these muscles here. Now, because this is a linear strength profile, so basically it's going to be consistent because the line is going right through here. This will be most challenging when the infraspinatus is short. So basically we're going to get some really good shortened range infraspinatus stimulus. So what we want to do is that we're going to fully shorten it. We're going to drive supination. So we're going to go supination in that shortened position, and then we're going to unload it. So we're going to go forward like that into pronation. If you can take a little bit of a step back there, please, Bud. And then what we're going to focus on is that we need some torso rotation, where we're going to rotate the torso backwards into the row like that, and then come forwards like this. And then the breathing drill, because as an external rotator we're going to couple inhalation with shortening it. So Will's going to breathe in and just rotate like that and back out. And then we want to make sure to get some torso rotation, so not just actual global rotation of the body. We want to get the hips to stabilise a little bit more. So the way we can do that is if you put your right foot forward, your left foot back, just stagger slightly, keep that as a base, so don't let the hips move. I just want you to drive torso rotation and breathe in and out like that, and just do this really fluidity. And you're not saying to the client, right, I want you to do 10 reps. This is where you might say do 30 to 60 seconds, and just getting the rotation and just getting all those muscles at the back to really work and fire up. And what we're getting is that because it's such a hard muscle to specifically target, by just continuing to do that, what we'll get is this muscle will work eventually. Now, another thing to be mindful of is neck, is get them to look forward and stabilize the neck, and always looking directly in front of them, because that will promote even more rotation through the upper thoracic spine. If they turn the head with it, they might not get that as much. So just nice deep breaths in, rotating through there and backwards, and just keep doing that quite fluidly. So this is going to help that rotation at the elbow, rotation through the thoracic. You can also play around with it to see what they find more challenging. So what you can do as well is, if you go forward, now I want you to actually supinate at the top, and now I want you to row and do a pronation backwards. So pronate like this, good, and back like that, and you continue to do that. Does that change the way it feels?
Probably slightly more activation.
In the front down. Okay. So now we're going to go back to that initial one. So I want you to go pronated like this. Nice deep breath in, rotate, go that way. Brilliant, and back. And then forward and back like this. So remember, external rotations are not going to be as specific. What we want is to actually get the global movement where we're reinforcing supination, we're getting rotation in the torso, but also muscles here really have to work. And then what you can get them to do is an isometric, so just hold that position, look forward, relax the shoulders through there, and just breathing and holding there, you'll just start to feel all the different types of shoulder rotators moving here. You can even, if you wanted to, get them to stabilise through there, so now just relaxing the shoulder, posterior shoulder muscles are working, and now just hold that and supinate, so elbow goes there, supinate and pronate through there, and that itself will just again drive some more muscle recruitment around here, whilst here is having to work in a shortened position, and that's going to give you a much better chance of targeting those muscles than the standard external rotation exercises.